Hello, welcome to the Harlingen Consolidated Independent School District and Valley Baptist Health System Education Talk. I'm your host, Joe DeLeon. Maintaining a healthy, active lifestyle and improving your physical well-being is important. We are now approaching the months in which many want to get outdoors and exercise, play sports, and much, much more. But with exercise and sports activities, sometimes comes injuries. Oftentimes called sports injuries. The Center for Disease Control estimates that more than 2.6 million of Americans visit the ER every year for sports and recreation-related injuries. Which brings us to our next guest, Heather Smith, a board-certified family nurse practitioner from the nationally recognized and award-winning Valley Baptist Health System, a healthcare provider of this community for nearly 100 years. She's a graduate of the University of Texas Pan American School of Nursing and has been practicing for nearly a decade. Ms. Smith, thank you so much for joining us today on the program. I'm really excited to talk to you. I have a lot of questions, and this is going to be a great conversation. I just have a couple of questions regarding injuries that are most common to a lot of the athletes who play basketball, football, soccer. What are the most common injuries that you see coming from those kinds of athletes?
Mostly we see things along the knee injuries like ACL tears, meniscus injuries, which is like cartilage tearing within the knee, or ankle sprains, fractures, wrist fractures, finger fractures, clavicle fractures, all types of broken bones. We also treat dislocated shoulders, elbow injuries, just pretty much anything. I also treat concussions and do concussion management for the school district.
That's amazing, and I bet there's a lot of concussions, right? Especially from soccer players.
Yes. Not soccer, more than football.
That's insane. And so how can parents, especially this summer, we have summer coming around the corner, and a lot of their kids are going to go outside and play sports or activities with their friends. How can parents protect their kids against a lot of those injuries?
The most important thing to do is stay active. It's a whole lot easier to stay active than to recover from an injury. The greatest indication for prevention of an in-season injury is off-season conditioning. So HCISD has a great opportunity with open gym and regular conditioning programs throughout the summer. You can talk with your athletic trainers and your coaches about those things to make them be active, stay active, do more, not less. Don't wait until football season to become a football player. Don't wait until basketball season to become conditioned to be a basketball player. You need to stay active year-round so that you stay nice and strong and are ready for the season.
So let's talk a little bit, we talked about our younger generation. Let's talk about our older adults who want to participate in some activity and some sort of exercise, form of exercise. I know my grandma, she asked me all the time, she's like, what do you think I should do to work out? You know, because she wants to do something, and especially with COVID and people being indoors, what type of exercise would you recommend or advice would you give to those individuals?
I think it's important to start slow, start simple. Even the American Heart Association recommends 30 minutes of exercise 3 to 5 days a week. But also if you have any cardiac limitations or any sort of health problems, make sure for the elderly population to seek permission from their primary care doctor before engaging in any rigorous activity. But usually just starting slow with a couple of days a week, walking outdoors, or if you feel unsure, then you can walk with one other person if you are both vaccinated. But also the managed care plans take opportunities to provide free gym membership to the elderly, and it's part of your insurance plan. So if you're on a managed care plan, then you check with the local things for a Silver Sneakers program. They have fully trained and vaccinated people that are there to help you learn how to use equipment, what's too much, what's right for you. They also host classes that are socially distanced, as well as everybody that's vaccinated in those classes for a safe physical activity.
And so right now we have a lot of our younger and older community members who enjoy power walking and biking. And so what advice would you give to them for their well-being?
Make sure to observe times of the highest temperatures. That's one of the greatest risks of exercising in the summer, is the risk of dehydration if you try to do those exercises during the afternoon, the hottest time of the day. So try to schedule your exercise to be either early in the morning or later in the evening, and make sure to hydrate afterwards. But also start slow. You don't have to do a full 2 hours every day your first day out. You know, start slow and gradually increase.
And that's important because I recently went biking with one of my friends, and believe it or not, he didn't hydrate. I'm not trying to call him out. He didn't hydrate, and his attire was not appropriate. He was wearing joggers and a sweater, in 100-degree weather. That was the day it was 100 here in the RGV.
Yes.
What advice would you give, or what should people wear to going out and doing physical exercise outside, especially in these temperatures?
You need to wear some lightweight clothing. There's things like dry fit clothing that has become relatively inexpensive these days. Something loose fitting that is usually more comfortable. But also don't cover up from head to toe unless you're adequately, used to it and can recover with some hydration.
It's very, very important. Hydration is extremely important.
And not just water, but electrolyte replacement. So you need to make sure that it's not just water replacement, but also your electrolytes.
And that's very important, and I'm glad you brought that up because, a lot of people like to go to Gatorade. A lot of people, Pedialyte's coming around the...
Pedialyte.
It's coming back.
There's gels, there's chews, there's...
So many things.
So many things that you can...
What would you recommend? Not a particular product, but in terms of somebody getting their electrolytes fast, what would you recommend somebody with?
Any of those sports-related drinks, and if you're a diabetic, make sure to go for the 0-calorie ones, so the lower in sugar, so you're not messing with the blood sugar a little too much. But also just, water and a good snack also, getting some protein in there as well after you exercise. But the electrolytes, just any of your sports-related drinks or chews, there's lots of varieties on the market.
That's fantastic. I need to go.
Available at the local grocery store.
See them at Target. See them anywhere you go. Not a sponsor. Let's talk about running. We just talked about how the younger and older generation are running right now. And I've experienced this. And so I want to kind of touch it because I don't know if other people have. I notice after I run for a while, I start experiencing sort of like a cramp in this area, some type of pain. Do you know what that is or what might cause that?
It's usually due to just an increase in aerobic activity can create just an imbalance of the fluid in the muscles or something along those lines that creates you need to slow down a little bit, take some deeper breath, allow the muscles to recover and get the oxygen they need. Usually it's been pushing a little too hard, so just back off just a bit and slow your breathing, control your breathing, and it's usually due to a rapid onset or at least a 2 advancement in that workout.
So they're just pushing harder than they should. And I feel like that's an important question because if somebody goes out, they work out, let's say for the first time, right? And they start experiencing those symptoms. They feel pain, they feel like, oh, I can't do this anymore, and they stop completely.
Correct. And that's
not what you want to do. You just want to slow down, take it easy.
Back off just a bit, either in intensity or duration. It's usually just a little too rough of a start.
And so that's fantastic. Thank you so much for that. And so we have a lot of our elderly who are working out at home, doing exercises in place at home. And they're using chairs or using things that are accessible to them. What should they do for their safety in terms of, using a chair? It's a little unstable, it's a little wobbly. What would you recommend?
It's completely individualized and based upon their baseline strength. There's a lot of YouTube videos. There's also a lot of information at orthoinfo.org, and that is a patient education platform done by the American Academy of Orthopedic Surgeons that talks about home exercise programs. They talk about shoulder rehabilitation, knee rehabilitation. It can give you some helpful hints on how to work out after a knee replacement or how to do things after a hip replacement. And it gives some basic with pictures and examples of a safe way of doing it. These are some handouts that I frequently give at my office.
And so let's just say somebody were to get injured, regardless of age. What should they do right after they experience these injuries?
The first thing is to identify whether it's an emergency or not. Now, if you can't bear weight, if you can't walk on your leg, or if your arm or leg looks extremely crooked, that's an emergency. You should probably go to the emergency department and get treatment. If it's something that has been going on for a long period of time, or if your knee hurts but you can still walk on it, then that's something you can either see your primary care doctor or come to our office directly, and it doesn't need an emergency room. But basics of first aid is RICE: rest, ice, compression, elevation.
RICE.
Just the basic. RICE, rest, ice, compression, elevation.
I didn't even know that. That's fantastic.
Yes, it's basics.
I love that. And the funny coincidence that, when your phone gets wet and it's broken, what do you do? Rice, you soak it in rice.
That's right.
So what services can one expect going into Valley Baptist and kind of the treatment that they'd receive?
The emergency room is obviously the entry point for most of our injuries. in that the emergency room staff does an excellent job of doing the initial evaluation, x-rays, and then also the stabilization, whether it may be a splint or if a joint is dislocated, they put that back into place. They tend to do the initial evaluation for the orthopedic team. And then my office, the surgeons in my office are on call 24 hours a day, 7 days a week to handle any injuries. And we have a wide variety of orthopedic surgeons at Valley Baptist Harlingen. We have Dr. Tijan, he's our orthopedic traumatologist that handles the complex fractures or the really bad injuries, including pelvis fractures and anything really dramatic. We also have Dr. Poulos, which is our hand surgeon that handles anything below the forearm. And then we also have Dr. Patil, who's a general orthopedist. He sees ages of all ages, but handles a lot with our pediatric population. And then we have Dr. Horton, which is our sports med guy. And he does a lot with the athletes, but he also is a general orthopedist and will see kids of all ages.
And I'm sure you've seen all kinds of injuries in your field, and that is remarkable. Thank you so much for speaking with us. Is there any last words that you would like to impart on our viewers before we leave here today?
I'm one of those people that I'll see anything once. And so if you feel that you are having an injury or struggling with a workout or have some questions about aches and pains that you get when you do a workout, I'd be happy to offer my advice. I'll see anything related to a muscle, tendon, bone, joint, neck pain, back pain, concussion. I'll see anything once. And if I can't handle the situation, I know exactly who to send you to. And so throughout Valley Baptist, we have an advanced network of physicians of all sorts of specialties. We can certainly take care of your injury.
Fantastic. Thank you so much for your medical advice and speaking with me today. Sure. I've thoroughly enjoyed our conversation.
Great.
Thank you so much. Please visit www.valleybaptist.net to learn more about your health and wellness, including available services at your Valley Baptist. I'm Joe DeLeon. Thank you again for watching this edition of Harlingen CISD and Valley Baptist Health System Education Talk. You can watch this program on KHGN's YouTube channel, or you can also download and share this program on the Valley Baptist Facebook page. Just look for them on Facebook at Valley Baptist Medical Center. Thank you so much. We'll see you again next time.